All right, 1, 2, 3.
Hi folks, we're going to give it a few more minutes until we'll start the training. Give some time for other participants to log on.
So how many participants do you guys usually get?
We have about All right, aloha folks. Hope everyone can hear me online. We have about 145 participants, and I'm assuming a few more will log on. Well, thank you for joining us. This is our first training that we are running since Val Yonted retired. I am part of the Hawaii Public Health Institute. We're the team that's taken over since Val has passed on the hui onto us. So just going to run through a little bit, few of intro slides, and then we're going to pass it along to Sheri, our trainer, to give you folks the training you're all here for. So folks who are joining on Zoom, this is the code on the first page. You have the webinar ID. This is the code if you want to jump on the computer or if you want to dial in by phone. Today's training is titled E Ola Mau, the next generation of Native Hawaiian Health. This is our first 2019 training for the Hawaii Healthcare Professional Series. All right, so just a few organizers. Stephanie Moyer, she's on maternity leave right now, so I'm stepping in for her role. Stepping in for Stephanie, she is on maternity leave and she should be back by our July training. My name is Makamai. I am the Contracts, Grants, and Operations Assistant hosting the training today. And another group that helps organize these trainings is our Public Health Training Hui Steering Committee, which is compiled of 14 members. Okay, our sponsors for this training, we have our hui, the Hawaii Public Health Training Hui. We are a collaborative that offers ongoing continuing education to all healthcare professionals and community members working in Hawaii to promote health, social welfare, and well-being. We also have our partners, the Western Region Public Health Training Center, who have partnered with the National Coordinating Center for Public Health Training, plus 9 other regional public health training centers and 40 local performance sites across the nation to form the Public Health Learning Network. Also, another partner of ours is the Public Health Learning Network, which this project is supported by the Health Resources and Services Administration, the HRSA branch of the United States Department of Health and Human Services. All right, we have these 5 continuing education credits that will be offered with this training. We have it for social workers, clinical social workers, certified substance abuse counselors, certified health education specialists, registered dietitian, registered dietetic nutritionist, and registered dietetic technicians registered. And we also have for nursing as well. Folks who are requesting the CEs, you must first attend this training. Stephanie or myself, for the time being, will send you a web link for the evaluation survey following this training. You folks will please submit that or complete that immediately after the training or within 10 days. After the 10 days, we will send you a certificate of completion. Also, following this training, you will be sent the link for the nursing credits. I will also be posting it throughout the chat. Folks who are obtaining nursing credits, you must attend and sit through the entire webinar. This website now is password protected, so on the sheet it will show you your password. So please make sure to once you log in to obtain your credits, also use that password. It'll send you right through the survey. Folks who phone in, please email Stephanie or email myself. My email is listed below for your name and with your name and phone number that you used today, so that way we know to track that you've attended the training. And folks who, if you are missing certificates after 2 weeks, please reach out to myself or Stephanie so we can follow up with that. Oh, sorry. This is the webpage for the nursing evaluations that will be sent to you folks immediately after this training, or I'll also post it in the chat. Please make sure if you are searching for nursing credits that you will log on to this website and use a password protected and use a password to log on to the evaluation. And just so you folks know, the planners and presenters here have no relevant financial relationships to disclose. And here are the instructions for Zoom for folks who are coming in Zoom. We are also posting this website, these trainings and the recordings on our new YouTube channel. We've absorbed it from Val, but we've also renamed it to the Hawaii Public Health Training Hui. Today's learning objectives is to review of the E Ola Mau, the Native Hawaiian Health Needs Assessment of 1985. We're also going to highlight a few chapters from the E Ola Mau, revisiting the study and the recommendations that will move forward to improve the health and well-being of Native Hawaiians. Last but not least, let us introduce Sheri. She is our trainer for today.
All right. Velina mai kako. As we get kind of set up technically here, I'd like to welcome everyone to the virtual learning room that we're in today. And mahalo to Hi-Fi in taking over the training hui. I know many of us have called in before when Val was running this. So big mahalo to Val for kind of holding down the fort, as well as Hi-Fi, Makamai, Roella, Jessica, and the entire team for kind of, helping that kuleana forward. So thank you so much. I'm going to assume I look here. You can sit at that. Okay. So again, mahalo for everyone joining us. I believe we're going to leave some time at the end for questions. So I want to respect people's, time and learning. So let's get started. For those of you who don't know me, my name is Sheri Daniels. I'm the Executive Director at Papa Ola Lōkahi, which is the Native Hawaiian Health Board, with our prime kuleana of overseeing the Native Hawaiian Healthcare Improvement Act and the oversight and accountability of that. And we do that through several mechanisms, including our Native Hawaiian healthcare systems that are located across the state of Hawaii, our Native Hawaiian Health Scholarship Program, and as well as policy and legislative advocacy. So if you have more questions, please, don't hesitate to raise your hand and we can kind of answer them. I'm also currently the chair of Nali Mahana o Lonopuha, which is a consortium of various organizations throughout the state of Hawaii looking at moving the Native Hawaiian health initiatives forward. So got to give a shout out to that. So as you guys see on your slides, and I'm hoping everybody can see it, I want to take a little bit of time to talk about E Ola Mau. It is the 1985 study that really was the catalyst, was really the starting point of identifying health disparities for Native Hawaiians. And for those of you who know or maybe who don't, we have to give props to Dr. Kekuni Blaisdell and his team for really convening this gathering of health professionals to really take an honest look at what health looked like for Native Hawaiians in the mid-'80s. And so what we did was, and E Ola Mau is available on Papa Ola Lōkahi's website in our clearinghouse if you want to look at the whole series of the different chapters. But the chapters included 4 really big areas: historical and cultural, where there was an overview of not only the history part of it, but really how culture integrated in the health of Native Hawaiians. We also looked at medical, we also looked at mental health, and dental and nutrition was combined into one chapter. And you'll notice that in our revisit, that was actually separated out. What I did want to point out is, separate from today's training, if you haven't seen it already, I would suggest looking at the social determinants of health video that is located, and I have the Vimeo code on there, but you can also find it on OHA's webpage under Mauli Ola, and it talks really about the framework of social determinants of health in relationship to Native Hawaiian health. So it's a really good starter video to just get an introductory lesson in social determinants. And we know that that's really the movement that many organizations are kind of heading on, including the federal government. So basically, the E Ola Mau study talked about our disparities as Native Hawaiian people, and what it did was it created the Native Hawaiian Healthcare Improvement Act in 1988, and that's our first version of it. And basically it says that POL is to raise the health status of Native Hawaiians to the highest possible level. Now I put that in quotes and I put it out there because I want people to think about what that means. When we're working with our Native Hawaiian communities, individuals, families, what does that mean to raise the health status? And I think that is all left up to interpretation. And so what that allowed us to do was start looking at what those critical findings from E Ola Mau was. So we know there was 3 top findings. One, that Native Hawaiians didn't access care in a timely fashion, meaning that, and same thing with bullet point number 2, that they often went later in stages of disease. So oftentimes treatments were not as readily successful. They're often more expensive, and as we see in their poor outcomes. So it allowed the belief, or perpetuate the belief, that Hawaiians, when they go to a doctor or especially to a hospital, that really they're going there to die. They're not there to get treatment and then go home and live a productive life. So those were some of the things that came out, but also that for our Hawaiian communities, they were going to doctors and not seeing people that looked like them, talked like them. So the ability for them to want to go and get treatment or preventive activities were lessened. So therefore, one of the things that came out of the study as well, and you'll see it in the slide, is that the overall death rate of Native Hawaiians, and this is back in the 80s, were 34% higher than the US average. If those of you have been tracking this, and I know the folks at JABSOM have been doing a fantastic job. I believe about 2 years ago, they put out a report that now Hawaiians actually have reduced their life expectancy. So it's 6 years less than the Hawaii average. So that's a good thing. We're making some progress. But I think one of the challenges that we'll talk about as we look at the revisit is how big of a change have we done in the last 30 years? That's the question. I like putting the percentage of higher of these chronic diseases, because chronic diseases back in the mid-80s was what really propelled the act to be created. And people always look at the diabetes one on the bottom and they think that I've misprinted it. But back in 1985, the incidences of diabetes were 222% higher than the US average. So currently we're about 124%. Improvement, but still pretty significantly high. So I talked about the Native Hawaiian Healthcare Improvement Act, and what it did was it created Papa Ola Lōkahi as the oversight mechanism for the act, and then our 5 healthcare systems. So we have Kauai, Oahu, Molokai Lanai, Maui, and Hawaii Island. And they're there to provide not necessarily primary care, although some of them have that. That was being identified through the FQHCs. So the Native Hawaiian healthcare systems were really designed to have the cornerstone be about community engagement, community health workers, health navigators, outreach workers. That's really the cornerstone of what Native Hawaiian Health was modeled. We were modeled against the FQHC, but really looking beyond primary care and more community-based care. So that's where we're looking at workers going into communities, working with our communities to get them to the doctors, to get them to engage in preventive services. So that was really the mechanism that was used. We also have the Native Hawaiian Health Scholarship Program, and to date we have scholared about 273 scholars over the last 25 years. And really the intent of the scholarship program was to help build a workforce capacity over time. So it's not just scholaring doctors and nurses, but really looking at those other allied health professions, such as nutritionists, social workers, pharmacists, dentists, and now we're able to look at expanding to include certificate programs, because as we know, the needs of our communities are not just a cookie cut. So we have to be creative and look at the opportunities that are out there. So those are some changes that we're looking at to meet community needs. We also have a traditional healing component. In the state of Hawaii, we oversee HRS 453-2, which is our healers law that talks about kupuna councils and the oversight that POL has in recognizing those. We also partner in research and data. So we work with organizations, including JABSOM and other community-based research initiatives, to look at how we can monitor, track, identify research that are being done for and about Native Hawaiians. And we know that has really focused on chronic diseases over the last several decades. But what we're also seeing is a trend increasing to look at other areas, including mental health, including resiliency, and also now including those Native Hawaiians that are living on the continent. We know we're seeing a growing number of Native Hawaiians migrating over to the United States continent and Alaska, and really looking at, do their health disparities look similar or different than ours? Why do folks reside on the continent for 30 or 40 years? So there are studies that are now looking at those types of questions. And POL has been working with our partners on the continent to make sure we can be supportive of those efforts as well. So just a brief timeline. Papa Lōkahi, Congress passed the act in 1988. In 1992, it was reauthorized, and again in 2010. And we're a community-based non-governmental entity, and we really are the body in which the federal agencies enter into consultative work around the issues, specifically Native Hawaiian health. But we also know, if we look at health, health is not just focused on chronic diseases. Health includes how education plays a role on this, housing, access to food, the data that we collect on our communities. All of those things impact the health of a Native Hawaiian. So, as we talk about E Ola Mau, and a Mau is really into the next. And so that's why it's called, as we look into the next generation of Native Hawaiian health. We wanted to look over the last 30 years and start to compile any kind of areas of issue, trends that are emerging, things that stayed the same. And I will talk a little bit more towards the end about some of the lessons we learned in this 30-year gap, including the recommendations and the follow-through on those recommendations. But we're going to talk about 3 different areas. I'm going to talk about behavioral health. I'm going to talk about workforce development, and then I'm going to touch upon, I think I have one more. I'm like missing with my notes over here, oral health. And so our mental and behavioral health, I do want to give a shout out to Drs. Nalina Andrade, Deb Goldberg, Earl, over at the Department of Psychiatry, who really spearheaded this group and kind of led the example, or created the example that we were hoping to get from this. So this is really sneak peeks. If anyone is interested in these specific handouts, please, I'm assuming you can email Makamai and request those. The full report will be released in the next few months. We're going to be doing soft releases on the different chapters so that people can take a look at it, and then it'll come out into the whole series. And what we wanted to do was make it so that folks can take pieces of it, or they can look at the whole package. But we know in some of our communities, certain areas were much more of a need and wanted to kind of respect that request. So our E Ola Mau series is actually going to be separated by each chapter and makes up the whole package, the whole series package. So, and I'll talk about dissemination plans as we kind of go through the slides. So as we take a sneak peek into mental and behavioral health, if you look on the corner, you'll see highlights. And these are the highlights that's specific to this chapter. We will have a slide that we're gonna talk about things that overarch in the whole series, so we can see what those highlighted points look like. If you look to your far left, you'll see the increased understanding. So we wanted to see, over the last 30 years, what has changed in terms of learning in that area, learning areas. What are things that have been working? What are things that are still a challenge? So we wanted to kind of break it out into increased understanding, promising approaches, because we'll see in some of the chapters that things have significantly changed over the last 30 years. Gaps, and we know in some of our chapters the gaps actually remain the same as the original 85 study. which in itself says a lot. And then we talked about recommendations for impact. And the recommendations is what we're looking at in tracking long term. So in behavioral health, you'll see that we know that the publications associated with behavioral health has increased. We also understand that the scope of these issues, as well as the risks and protective factors, were also looked at and expanded. We also know that Native Hawaiians manifest greater mental health challenges than those of their non-Hawaiian counterparts, which a lot of this was also covered in 1985 in starting to identify mental health, behavioral health as an emerging issue. And we also know that Native Hawaiians are dealing with multiple stressors. This isn't new information. We know from socioeconomics, we know from mental health, incarceration, all these other factors that Hawaiians tend to be on the lower end of the spectrum is verified with the studies that they've looked at. They also note that cultural activities often promote healthier lifestyles and decrease stress. So looking at that, how do we integrate more of these cultural practices into programming, into program development? But it's not just, I think one of the pieces programs need to look at is just calling it doesn't make it, meaning just because I say I plant some tea leaves on the back of our building doesn't make it a mala, and therefore does not make it a cultural program. I think organizations need to really look at what it means to be culturally aware, culturally mindful, and integrating and incorporating cultural services and practices in a way that one is meaningful, it's realistic, and it's maintainable. I think it's okay for organizations, excuse me, to be very candid and honest with themselves on their ability to execute cultural programming. And not only from a Native Hawaiian lens, I think if we look at other minority cultures and communities, the other Pacific Islander groups, I think we can see a lot of overlap and similarities, that if we start saying that things at minimum is appropriate and enough, then we never make a impactful change. And so I think that's something that's very important for us to consider, is that when we're looking at promoting cultural activities as a way to improve client outcomes, client success, that we really have to look at how programming is developed and used in the actual day-to-day operations of an organization. This group actually put in some tables and talked about anxiety, depression, suicide attempt, as well as substance use, both from youth, in adults, and with kupuna. And I think that's really telling, and what we're seeing in communities, especially when we look at the line related to suicide. We know that that is a growing need in our community. How we capture that, how we collect the data is going to be very important. As we go down that side, if we look at promising approaches, we look at these programs that provide a balance between the Western best practice as well as our cultural teachings. And I think, as I said earlier, right, is organizations or programs really looking at what they do well and what lane they drive in. I think it's okay for organizations to partner and collaborate with others to enhance the services that are being delivered. And I think that's the other thing, is a lot of these programs are designed when they truly collaborate to foster healthier Native Hawaiian mental health and behaviors. And ultimately, that's what we're looking for. In terms of gaps, while we know that there are programs that are found to have been successful in improving the well-being of Native Hawaiians, we also know that we still need to create evaluation tools for most of these culturally based and adapted mental health programs. And so we also want to make sure that there's connections between the historical trauma that we have in our community, as well, and intertwining that with our contemporary stressors that we know that have been impacting our community. We also know that we have few studies that focus on Native Hawaiians across the lifespan, and that's something that I think that needs to be looked at. How we do that, I think is going to take a multi-agency, multi-collaboration approach, because we're looking over a lifespan. Some of the recommendations that we looked at for impact is to really look at effective community engagement programs. And I think having really an honest assessment of what that means for organizations and for our community. Expanding effective culturally based and culturally adapted prevention and interventions. I think prevention and intervention has to work hand in hand. What we realize is when all the funds are being put into intervention and not into prevention, it's hard to kind of combat the problem. And we know yet that prevention takes more effort, and we see the results more down the line. So oftentimes that's not the funder's choice, because they want to see more of an immediate result, thus the interventions. We're hoping to decrease stigma and ensure access to services. We want to increase the workforce through training of mental health providers. We know that there is an increase of Native Hawaiians in the helping profession, including social work, licensed marriage and family therapists, certified substance abuse counselors, but still we need to increase that workforce area, and to also include psychiatrists, psychologists, and all of those other pieces that work with families, individuals, and communities. Enhance funding and resources for mental health. Like anything, funding, I believe, is going to be seen across all of our chapters, because I think there needs to be a commitment on many levels to fund not only one, because what we're going to realize is they all intersect together and interweave into each other. And so we know that Hawaiians don't just have one problem. We're just not dealing with behavioral health. That behavioral health is one, but they also could include oral health. It could include workforce development. It's a lot of these pieces that play into each other. So funding is going to be important, not only for one area, but for all the areas. We also need to incorporate a systems approach that utilizes the social ecological model and focus on long-term sustainability. Like anything, when we work with communities, when there's a great program that's funded, if the monies dry up and the program ends, what happens to communities? And that's what happens is when things aren't sustained, we cannot see long-term change and improvement, because we're constantly having to restart when the money cycle comes back around. So really looking at the well-being and looking at factors that at an interdisciplinary level is going to be really important. I wanted to talk about the highlights. So the highlights of, I think, with this section, I kind of covered, but I think we're going to see some of these that spill into the other areas. So hopefully when you're looking at these slides, if there's ones that kind of stick out for you, look to see if you're seeing it in these other two that we're going to talk about. Now keep in mind, I'm only touching on 3. We have other chapters that include data governance, nutrition, and so there's other chapters that are not being discussed, and a lot of it was due to time. So again, if you're interested in the whole series, please let Makamai know your email so we can get you on the when the release of it. So our next one, and I'm going to assume we're going to leave questions for the end. Okay. So if you have a question, please write
it in the chat, or they can type in the chat.
So Makamai is saying you can add it in the chat if you have a question now that's a burning question, or just write it down and you can ask after the presentation. So the second chapter we're going to talk about is oral health. So oral health, a couple of years ago, the state of Hawaii came out with an oral health report, and that was looking at keiki oral health over a period of time and some of the disparities that we're seeing here in Hawaii. The challenge with that report that the department did was it actually did not separate Native Hawaiian oral health numbers with those of other Pacific Islanders. So I think that's the other thing when we look at data is whenever you're looking at data, how true is it to just looking at our Native Hawaiian community, or does it have other communities that are part of a bigger, the bigger picture? So with oral health, they did identify needs, especially with youth. We also know in this past legislative session and the last few years, there's been an increased need in reinstating the Medicaid benefit for adult oral health care. And so just looking at those two things in the last 2 years, we know that oral health has changed since 1985 in terms of really the data that's been collected, the different research on it, and the need for how oral health fits into the health of our people. Is that mine? Sorry, there's like little dings that happen. So, okay, so we know that in oral health, there's been an increase of research over the last 30 years, including a lot more publications. There's an increased interest as well as a need in oral health here in Hawaii. We know that oral health impacts the ability for people to eat, to enjoy the dietary choices. And that's why in 1985, if you notice my original slide, oral health and nutrition was actually one chapter, because they felt that there was such a correlation between the two that they that they tied into each other so well. It was one chapter. But in this series, we actually took it apart only because there are so many promising approaches happening in nutrition, from food sovereignty and some of the farm to table stuff, and in oral health, that we wanted to make sure each had its ability to shine on its own and show its needs separately. We also know that oral health affects people's speeches, their socialization, but we also know that it does impact general health, including diabetes and cardiovascular diseases. We know that oral health inequities exist among Native Hawaiians, both in adults and in children. We know that there is a need to have a more robust dental health workforce of Native Hawaiians. And you know, I do want to say, we're not saying that we're only looking at Native Hawaiians to fill these workforce gaps. We understand that that may never be a reality, but what we also want to do is make sure that those that are working in our Native Hawaiian communities and with our Native Hawaiian families and individuals, that they have that cultural understanding so that the work and the services they do deliver are culturally appropriate. We also know one of the primary reasons that patients aren't seeing dentists is the financial burden associated with that. And specifically, Medicaid does not offer a very comprehensive adult dental package. Thus, over the last several years, the push legislatively to make those changes. The other thing is also the use of fluoride here in Hawaii versus other states. And so the report talks about that as well. Same thing with the other ones. We did provide kind of a chart, so you can kind of look at decay and for adults removal, so the different age ranges. And I think you can kind of see where that looks like. And especially for our adults, looking at removal rates, pretty significant for Native Hawaiians, 48.8%. Some of the gaps for this area, for this chapter, we were looking at the funding, the funding expansion for some of our systems and centers to provide more access, dental care access. So to have more capacity, to have chairs in their clinics, to do those kinds of procedures into the community, we know funding is going to be needed. And funding not only for the direct service type of delivery, but also the education and the prevention. So also, you know, teaching, especially for some of our other communities, the value of oral health and oral health care. Also looking at how we can partner better, gaps of partnering better, especially with school-based fluoride and sealant programs, to start having those integrated into communities, into large Native Hawaiian communities. They did include talking about restoration of the Medicaid benefits for adults. And then again, workforce being having more Native Hawaiians available in this dental workforce stream. So more dentists, more dental hygienists providing services. The other gaps they identified included improving data collection And I think data collection across all of our chapters, really to look at how we collect data, why we collect data, and how we use the data to integrate into programming across all of our areas. We also want to look at how we can provide educational resources to adjust oral health disparities from a Native Hawaiian Health concept model. And then looking at water fluoridation. For the oral health, when we looked at promising approaches, same thing, right? When we look at the full array of dental services, we see them primarily on Kauai and Maui. Looking at how we can integrate case management to link especially children and their families to services and support. And then also providing prevention and treatment through school-based and other community initiatives. I do have to put a little bug in folks' ear. Hawaii has really done a phenomenal job with their virtual dental home projects that start off on the Big Island, and I believe it's on Maui, and there might be on other islands as well. But that is another opportunity to really think outside the box on how we can use technology to support a need in our community, get people seen, and really get the services in there in a way that's cost effective and engaging. So virtual dental homes, that's kind of the new things happening. So for recommendations on these guys, which is similar to their highlights, we're looking at restoring the dental health benefits, which I've talked about, and that's done through the legislature. This year's one didn't go through, so hopefully next year that can be something to push as supporters or as community health workers or people interested in health of our communities, because it doesn't only impact Native Hawaiians, it impacts all those that receive Medicare benefits. Looking at developing sustainable school-based sealant and fluoride rinse programs. So that's something, again, it's not only, yes, that's something we identified in Native Hawaiian communities, but it can be something that can be applied across the state in a variety of communities. Looking at implementing Medicaid policies that are school-based and community-based program-friendly. Develop workforces, which we talked about. Implement community-based programs that improve oral health of not only your keiki, but adults and kupuna. So really looking at the lifespan as well, especially for those in low-income families. Also, we want to look at and understand how oral health is seen within the Native Hawaiian community in terms of concepts and values.
Did someone ask about what the virtual dental home care model is?
So Stacy, the virtual dental home care model was actually started on the Big Island, and I want to say a couple years ago. If you want to go ahead and send your email, we can send you more information so you can have the correct information and know where else. And I know it's on Maui as well through Hui no Kiolopono. So I want to make sure I give you the right information. So if you want to go ahead and send us your email, we'll go ahead and forward that to you. But it's a model where they go into the schools, into the home with technology and are able to look at patients' teeth. And then they're working with a dentist who reviews that to see what kind of services might be needed in terms of do they need fillings, do they need extractions or things like that. So it's a way for workers to go into homes to get people to be engaged to go to the dentist. So it's a bridging program. So that's something that Hawaii just started a few years ago. Similar, I think it would be similar to the telehealth model of using technology to go in the home and do some of those practices. So for dental, it would be a caseworker going in, using an iPad or other equipment to do that, and a dentist looking at it from maybe not even from in their community. It could be a dentist on a different island. So please go ahead and send me your information and we can give you more detailed stuff. Thank you, Stacy. Okay, so that's oral health. So as we look into workforce development, and we've talked about workforce in the other 2 chapters, and workforce covers all the chapters. So like I said, we're going to talk about certain things that kind of bleed into everything, that covers everything in my next slide. So we know with workforce, there has been a lot of research over the last 30 years, and not only with Native Hawaiians, but when we talk about workforce development, workforce retention, all of those pieces, because Native Hawaiian communities aren't the only ones that struggle with retention of workforce. We know that people made, lifestyles change, their expectations change, and so how do we keep people wanting to be in communities that maybe aren't as favorable, especially in high rural areas, which we know for a lot of Native Hawaiian communities, that's what they fall into. So in general, there's been a lot more publications around workforce development, workforce retention. There's also been a lot more work around the scholaring of disciplines, providing loan repayment programs, those kinds of things for different health fields. And so those all play a factor into that. Native Hawaiians actually manifest a greater number of mental health challenges that we know. But we also know that that's also a workforce need, is we need more mental health providers to address those needs as well. We also, same thing with some of our mental health chapter, that cultural activities do promote more healthier lifestyles, decreased stress. Oh, you know what? I gotta apologize, because I think we used the same slide that was in the behavioral health one. I apologize. So it is not a workforce. Please don't look at the 2 pages. Look at the highlights. The highlights is from the chapter, not the 2 pages, and I apologize. I think my eval just went down. Sorry, at least I identified that. So if we look at highlights, let's look at there's 5 bulleted highlights. What the chapter identified was there needs to broaden and maintain a thriving Native Hawaiian health care workforce. So again, like I said in the beginning, it's not just doctors, it's dentists, it's pharmacists, it's social workers, psychologists, it's the whole spectrum. It's also certificate programs when we look at it, right? It's also the community health workers, it's the registered dietitians, it's the physical therapists, it's anything that we seek support in for medical interventions. We also should look at developing and maintaining a comprehensive centralized data collection and tracking system of our Native Hawaiian workforce. We know that there are some collection of that at the university level. For example, Department of Nursing may track their Native Hawaiian nurses that are going out into service into the community. Our Native Hawaiian Health Scholarship Program, we can track where our scholars end up, whether they maintain residency here in Hawaii or if they move to the mainland. So there needs to be, what they're suggesting is a better tracking of where these Native Hawaiian health professionals are and what kind of work they're doing. Now we also understand that our workforce shifts. So we know that many of them do move to the mainland for different opportunities, whether it's increased opportunities for employment, for moving up the ladder, or if it's cost of living that our health professionals are moving. We want to support existing effective training programs and develop and sustain new ones that will create and support a thriving workforce. So I think having that, what that looks like and what that means is going to be very important. So looking at partnering with folks such as Kelly Withy at AHEC in their workforce summit that happens every September to really look at how we can support those learning capacities in the health workforce. We want to look at increasing the quality and quantity of culturally relevant efforts of our workforce. So again, if we're doing training and we're doing opportunities of learning for our health professionals. Yes, we want to focus on Native Hawaiians, but we also want to focus or give attention to those non-Hawaiians that are serving our communities. This can be said in any of those minority cultures, right? That if we're going into a highly populated Pacific Islander community, we want to make sure that those that are delivering services understand those cultural norms and things like that. So how do we better prepare our workforce to support those types of communities? And for our case, our Native Hawaiian community. And then to advocate for existing and new procedures and regulations that support a workforce of Native Hawaiian health. So again, it's looking at what is out there that we can, as a workforce development piece, support so that we are supporting that process and not hindering it, or not providing opportunity for our communities to gain support. So one of the things I wanted to talk about was the common factors, which I mentioned earlier. So when we look at across all the different chapters, some of the common themes that have come out was talking about data. Keep in mind, we do have a separate data governance chapter that talks about that specific area, but we noted that all the chapters talked about how we collect data, how we share data, how we coordinate anything to do with data, and really about data governance, data sovereignty, and that has become a very popular topic even now, because if we're collecting data, if we're collecting data, so let's look at oral health. If 5 of us are collecting data around oral health and we're asking the same thing in 5 different ways, and we interpret the data 5 different ways, then you're going to have 5 potentially different reports that come out saying possibly different things. So how do we as a community bridge that, work together so that we can come out with a more robust, thorough report that might address the issues that maybe all 5 of us want to look at? So I think it's about how we engage smarter and more effective versus trying to operate in silos. The other thing that we saw as common thread was a culturally trained workforce. So not only did that come up in our workforce chapter, but for example, we saw it in behavioral health, right? That there needs to be more looking at how these workforces are trained in cultural programming so that they understand what that means. And as I've been saying a few times, not just Native Hawaiians, but with those non-Native Hawaiians serving our communities. Again, funding and resources, I think that's a given in anything that we do, is how do we pay for it and how do we sustain it? And I think that's where the collection and utilization of data comes in, because we all know that data drives funding in many cases. But we also want to be clear that we want to collect data that's meaningful and useful to our community, and that can help us create programs that make sense, that the communities can buy into, and it's not just created because it's created and there's funding for it, because that only impacts probably not positively on communities. Communities get invested in programs, and if they're not sustained, then it's not well for them, and then they're less likely to buy in the next time it comes around. And then we also see cultural relevancy, right? We see that pretty much painted through all the different chapters. Some of the new innovative practices that we've been seeing in our medical chapter, which I did not share with you folks, telehealth, but we're also seeing telehealth like in our virtual dental home process. So we're starting to see that in other areas. We're also seeing it in workforce, because we know utilization of telehealth means that these providers are doing it from a different way. They're not doing it in person. We also really don't know how telehealth is going to impact our community, in a community that is really much more comfortable with face-to-face interaction than they are via virtual. So I think that's something that we want to kind of monitor over the next few years, because if telehealth becomes a norm in practice, then how we train our workforce is going to look different. And then the other new innovative practice is the data includes food and data sovereignty. So especially with our food side, we see it a lot in our news. We're reading it in the paper, right? When we're talking about organizations that are looking at how food impacts our health, right? What we take in, and not only that, but how we grow it, the environment in which we grow our food, all of those things have impact. So it's not just the food that you're putting in your mouth. Yes, that's one piece, but it's also the other piece of how we grow it and how we interact that into the work that we do in the schools, with our families. You know, how are we teaching them to utilize these types of foods? We know that places such as KKV and their Roots Cafe have really done phenomenal work around having cooking classes, having things that engage their community, having products available for the community to purchase so that they can, you know, have the means and access to healthier options. We know there are programs on Maui, for example, that allow senior citizens to get coupons to go to farmers markets with the attempt to help to expand the integration of healthy foods into somebody's diet. So I think there's a lot of really cool, interesting things happening across the state in a variety of ways. It's just how do we help track that and help kind of point people into the direction so that they can see and maybe even partner or even create something similar in their own communities. So the next steps, I know 30 years is quite a lengthy time between reviews of this document. And for us, E Ola Mau, 1985 is really the cornerstone of Native Hawaiian Health. And you know, we wanted to not do it the service that it needed in terms of reviewing what has happened over the last 30 years. However, with that said, I think for Papa Ola Lōkahi, one of the biggest lessons learned in the last 30 years is that we can't wait 30 years. And we also have to hold our partners accountable to what the recommendations are. If anyone ever pulls E Ola Mau and looks at it, you'll see the recommendations are quite thorough, and it actually puts names to those recommendations, whether it's the Department of Health, whether it's PAPA, whether it's other Native Hawaiian organizations. The onus becomes POLs to follow up, to reconvene meetings with these identified parties that have kuleana around recommendation follow-up, and to say, are we doing this or aren't we doing this? If we're not doing it, how do we change, you know, the direction so that we can, or is that going to be somebody else's kuleana to look at? So I think we have to take that initiative to hold ourselves accountable, but also hold our community accountable in terms of what is really that's happening, you know, and it's okay that we don't do it. I think it's more of a disservice when we don't take a look at it. So with that being said, one of our goals is to actually do a community sharing of the E Ola Mau starting in May 2019. So this is the first kind of sneak peek out. The plan is to go to the entire state from May through December. We also are going to look at specific chapter reviews, because we know in some communities they're much more interested in certain chapters versus others. Not that we wouldn't give an overview, but a more deeper dive or a more comprehensive chapter review is planned in certain communities that have already asked for it. So like I said, the community sharing will start in May. We're looking at kind of at least till December, and then expanding into next year through July and ongoing as we need to. And during that time to also include those partners around updates. And like I said, part of the role of our recommendation partners is to help them work towards improving Native Hawaiian health through program services. And it's kind of all of ours. It's not one organization's kuleana to carry the whole burden. It's all of us to see how we can support each other. I think it's great in concept. It's harder to do in reality because not all of organizations' missions match each other. But I think having dialogue and communication about what they're able to accomplish is really important. So, And it's working with POL to really identify positive and negative aspects and impacts so that if there are some concerns, we can kind of catch it at the pass and maybe kind of do some realigning a little bit so we can try to have more positive impacts. And like I said, our role is to track the recommendations and to engage, and that includes the positive and negative, right? I think if we keep believing that it can only be positive, then we miss the lessons that we learn when we maybe aren't as successful or we kind of fall and fail a little bit. The whole point, right, is to get back up and try again or try a different way so that we can continue to be making strides forward. POL is actually starting a scoping project, and our goal with the scoping project is to actually start to bridge our community perspectives with E Ola Mau. We know E Ola Mau was really looking at research, looking at what's happening from that lens. And what we're looking with our scoping project is to actually get community feedback around what they see as gaps and successes in their community in relation to Native Hawaiian health. And again, health not just being chronic diseases, but land, education, housing, economics, things like that, access to not only health, but access to clean water, access to, drivable roads, all of those things that impact somebody's ability to be healthy and however they identify that to be. So our scoping project is starting off looking at our Native Hawaiian healthcare systems and their allied partners, and then we will be rolling out town hall meetings and community meetings starting in August to start looking at what that means. And what we're hoping to see is a traffic light model of red, yellow, and green, where we can look at different areas and see where communities fall. Is there enough success that they're green lighted, or are there so many barriers and challenges that that community continues to be a red light? What we're hoping that will create is an opportunity for communities themselves to see what they do well and where they can improve, but then that document can be used to engage with their community, their county councils, to say, hey, this is why we need more support around this area. And then on the next level, these county councils can use it to advocate for more funding at the state. Our state ledge can look at this document and use it to kind of gauge where needs are across the state. So when we're looking at department funding or other funding asks, there's much more of a reality check in terms of what communities are actually experiencing on the ground versus what's interpreted by a very siloed look at maybe one community in the entire state. So if you look at the scoping project that we're starting, it's really looking at districts or moku, and then island, and then step up higher and looking across the state. And then what that can allow us to do is then take that bigger state picture and comparatively look at it across the nation. Because we know there are Hawaiians across the United States. So I think it allows communities, organizations to have a very realistic, real-time document to look at funding, resource allocations, things like that. And hopefully we can create better partnerships with organizations to leverage resources together so that we can be all putting into the same pot and reaping the benefits, and then people can use resources for other things that maybe are not being addressed at this time. So that's our scoping project that will be done and rolled out to communities in the summer of 2020. And then the other plan with E Ola Mau would be re-examining our progress within 3 years. So E Ola Mau this year, our scoping next year, and then the following year would be, where are we? What's going on? And how do these two documents intersect together or not? Because that alone will also tell a story, right? If our communities are saying one thing, but yet in terms of research and on these other things don't match up, then that's a disconnect. And how do we address that? And if we need to. So those are some of the things that POL will take when we look at E Ola Mau and our scoping project. That's all I have. I'm not sure if folks have questions.
let me just turn on.
I'm looking to the side of my Papa now over here.
Let me see if I can just stop this video.
And like I said, we're on Facebook, Instagram, Twitter. There's our website. Our website is a treasure trove of all kinds of research. Oh,
My fault.
that's right. So if you go onto our website, you'll see our it's called a clearinghouse, but there's tons of just material, all kinds of stuff. So take a look, and if there's any questions, please, you have my contact. You also have, there's also a contact on our website as well. And we're always open for comments and feedback.
Okay, we have one question from a I'm going to go a bit closer to the side. Okay, we have someone who is a part of the Workforce Development Committee. They are excited about that you presented on their chapter. One of their thoughts was involvement through how it evolved through the process and how to move forward from a government-dependent sustainability to self-sustainability. What are your thoughts on that issue?
Well, I have many thoughts. Well, hi, Stephanie. Thanks for calling in, and I'm glad I could talk about your workforce, but they didn't have the 2 pages, so I apologize. I think that's a question every organization has, regardless of how big or how small you are. But I think that's where the integration of the scoping project and E Ola Mau is going to be really important, because I think sometimes there is a true disconnect between what government understands it to be and what maybe reality is. In some cases it might be in alignment, but that's hardly the case. And so until we have a really good understanding of what reality is, it's hard to become more sustainable, because we don't know what we don't know. So I think if we only look from one lens, we miss a big chunk of the other piece. And if we only look at the other side, so I think we have to look at them together to see where those true intersects come in, where the true gaps are, and successes, because I think that gives us a jumping off point. I think we want to get to a point where, we're not dependent on the government support, but that we are active partners in getting support to meet the needs of our community. I think that's where we want to go. I don't think we should ever not allow government to not take responsibility for what is their responsibility. But when you've got so much asks, and then how you play the game in getting funding is a game. I think that's where the challenges happen, and then people get left out where there's true need. So I think we're going to have to create balance and a reality of what the picture looks like. So E Ola Mau is one piece, the scoping will be another. I think looking at maybe another area, I think there's going to be multiple prongs that we're going to have to look at to see what the true picture is. So I hope I answered your question.
Okay, we have another one. Considering the long-time controversy over community water supply fluoridation, where does Papa Ola Lōkahi stand on that issue?
Ooh, to be perfectly honest, I don't think we have a stand on that issue. I think for us, we know that there is feedback both sides of the coin. I don't think we have ever really looked into the issue as an organization. So that's my honest answer. At this point, I don't have a stand because we haven't really looked at that issue as an organization.
Okay, we had another one saying, as you plan ahead for health data among Native Hawaiians, please consider reaching out during regatta season, race gatherings. It could help the overall perspective of Hawaiians to also include those many Hawaiians who regularly exercise and stay fit within a culturally historic and appropriate practice. It wasn't really a question, but mostly a comment if you wanted to.
Yeah, and I think we got to get creative outside the box. I do agree with that we get so caught up in the status quo of how we do things, of who we ask for information, that sometimes the the data's kind of, not the data, but the reports that come out are quite stale. And so I think sometimes we gotta go outside of our normal box and comfort zone to ask. I think sometimes we don't, because we don't think about that. We just go to the usual suspects, but we're gonna have to get creative and think out of the box. And that's kind of what the scoping is. It really is not something that has been done in other state agencies. This is really out of the box thinking. So we're hoping it provides some really interesting insight.
I mean, anyone else have any more questions? Want to add in on the chat or the Q&A? We have Sheri here ready to explain. I think someone raised their hand. If you could, okay, let's the chat. Okay. I'm happy to see a traditional healing component to Papa Ola Lōkahi. I am curious if energy healing is a part of that, and if so, how could I learn to be more to get more involved?
So our component around traditional healing is Native Hawaiian traditional practices and healing. So looking at, primarily we've been involved with the La'aula Pa'ao, Lomi Lomi, Ho'oponopono, some of those traditional healing practices. If you go to our website and look under our traditional healing components, you'll see. And then you can also reach out to our traditional healing coordinator, Babette Galang, and her email is on our website as well if you have more specific questions.
Well, I think that's it for any questions. If anyone has any last minute questions that they want to include in the chat, mahalo nui to Sheri for presenting to you folks today. Oh, do you have another person? Oh, I guess somebody just raised their hand. I think that was their question. Any last minute questions? Let's see, one more. This is so confusing. Did you have one from?
We're glad to be the test pilot on this. So thank you for being patient, everyone.
Okay. We have someone who works with severely mentally ill adults covering mental health cases from West Oahu. They wanted to get more information elaborating on the services offered for Native Hawaiians, and if possible, to have someone with to come down and talk to their team that is specific with mental health.
You know, and she'll probably kill me by throwing her name out, and she's been a presenter before, Dr. Aukahi Austin, fabulous. E Ola Mau, Hawaii is their organization of Native Hawaiian providers, psychologist group. So who is that? Joshua. That might be, I have your email. What I'll do is I'll send you Eola's information, but Dr. Austin is phenomenal and can definitely give you some support around that and information.
Okay, we got a couple more. Are you interested in partnering with Prevent Suicide Hawaii?
Sure. Yes. Sorry, I'm like looking, and yes, you have my email. Please give me a call, and this is Lucinda. Yeah. So Lucinda, shoot me an email. Actually, there's some work we're doing around suicide prevention, and in fact, there's a federal bill that just got dropped around early suicide prevention. So we can definitely talk story.
We have another one. Do you receive, share, or does the state of Hawaii DOH provide you data on Native Hawaiians receiving mental health services from state agencies?
So the Department of Health actually, it's called BRFIS, which is kind of like they put in data into a big database that's kind of nationally. And I gotta say, Hawaii's really good about inserting their data. But what we know, not only in mental health, but in substance abuse, that the data doesn't actually take out Native Hawaiians and that's part of the challenge, but also when they're getting services, they might not indicate Native Hawaiian, they might indicate something else. And so those kinds of things we've been kind of talking with the Department of Health on, and their new Deputy Director Eddie Mercero has been very open and supportive to having dialogue. So here at POL, we actually, because our focus is Native Hawaiians, not that we don't care about other cultures and communities, but that's really our mission. We asked the question of Native Hawaiian, yes or no. So for us, we look at it from a very different perspective, where from the state agencies, they collect the ethnicity very differently. So depends on what agency we're asking for and what information we're asking for. So in terms of like overdoses, for example, they don't necessarily track it by ethnicity. They can't disaggregate that data. So it really depends.
Okay, someone asked, will you be visiting South Kona as a site for when you reach out to statewide presentations?
Yes. So actually, we contracted with another company who's done this scoping work in British Columbia with the 14 tribes up there in the First Nations Health Authority, and we thought that that would be a better fit for us, only because as many organizations that do strategic planning or work facilitating with communities, we haven't seen anything that took kind of what we're looking at to the next level. So yes, we'll be visiting the different mokus across the state. So I believe Kona, Ka'u, I think Big Island, we went by the moku districts, and all islands. Oahu was a little harder because there's way more districts. So yeah, we will be visiting South Kona. And so this is Kenneth. So Kenneth, if you don't see it, shoot me an email. We'll make sure to make sure you're added in when that happens.
Any last minute questions? Any more pressing questions, burning questions you wanted to ask Sheri? Please feel free to drop them in the chat. If not, we will be ending it relatively shortly. Thank you again, folks, for sitting on this training. We hope you learned a lot. Oh, another chat. I feel like I see raised hands. No. Oh, I just got eager. No, I just want to
Just remind them of what this is.
Oh yeah. So again, the nursing information sheet was shared in the chat. So if you folks wanted to go back in, I scrolled it. It was shared a little bit earlier into today's training. The website to access the nursing evaluation is on that sheet, as well as instructions to get to the evaluation as itself, as so is the password. The password is progress, capital P, for folks who are still online. Other than that, please make sure to complete the evaluation that I will be sending to you folks later today following this training to complete our evaluation, so that way we can send you folks your well-earned certificate of completion. Other than that, mahalo nui for joining us. Our next training will be May 17th. May 1st, we'll be sending out the flyers, so please be aware for that. Other than that, have a great rest of your day. Mahalo nui to Sheri.
Mahalo.
And happy Aloha Friday, everybody. We hope. Okay, I'll stop there.
Yay.
Well, Ria said it sounded good. We were